Facebook?
On Facebook already. And
Okay.
All
All right. Great.
10 seconds. And go.
Good morning. I'm MMAC President Tim Sheehy. MMAC's mission is to develop Metro Milwaukee as a globally competitive location for businesses that deliver high-value jobs to foster a vibrant quality of life for all. Well, thanks for joining Business Strategies during the pandemic. This program is designed to provide actionable insights to the challenges and opportunities we all face in bettering the region as a place to live, work, play, and learn. Our next program will be Tuesday, October 20th from 11 to 12. This program is sponsored by United Healthcare. In times like these, a traditional health plan may not be the best fit for your business. So take a closer look at All Savers from United Healthcare. MMAC has partnered with United Healthcare to offer coverage for groups of 5 to 99 employees. Now small businesses can take advantage of the benefits typically reserved for larger companies, including underwriting for more competitive pricing, better data so your business understands where your premium dollars are going, and a surplus refund if claims are lower than expected. Contact your MMAC broker or visit uhc.com/MMAC to learn more. As is usual on this program, we're joined today by Dr. John Raymond, President of the Medical College of Wisconsin, who will again provide an update on the healthcare impact and status of COVID. After Dr. Raymond's update, we'll take a few questions. Then we're joined by Ken Goldstein, Professor of Politics at the University of San Francisco. Ken will share some recent polling data on the election outlook and public attitudes about COVID and the economy. He has a great national perspective and is respected for his nonpartisan deliberations. He appears on a full range of news programs from ABC, NBC, Fox, and CNN. Professor Goldstein also has a strong understanding of Wisconsin, where he served on the faculty at UW-Madison and is currently engaged in a regular series of polling for MMAC. He'll also be with us to answer questions. So without further ado, Dr. Raymond, I'll turn it over to you.
Good morning, and thank you, Tim, and hello, everyone. We'll start with the testing as of yesterday. If I could go to the next slide, please. And next slide, thank you. So far in Wisconsin, we've tested about 1.6 million people, with nearly 300 of those happening in Milwaukee. We've had 134,000 positive tests in Wisconsin and 30,000 in Milwaukee. And as of yesterday, we had 14,361 people reported as having received results from their tests. Now, our daily positive tests have been trending very unfavorably in Wisconsin over the last month, although over the last few days, there may be some early signs of leveling off. Now, yesterday, Wisconsin reported 1,696 new positive cases, with a 19.7% case positivity rate, with a 7-day average trend that is stable. Now, Milwaukee only reported 64 new cases yesterday, with a 7-day case positivity rate that actually is beginning to trend favorably, although it remains high at 12%. Also, it's important to know that our daily cases in Wisconsin have exceeded 2,000 13 times since we first exceeded 2,000 on September 16th. Now, this morning's New York Times reported that 3 Wisconsin metro areas are in the top 5 for the greatest number of new cases in the last 2 weeks per 100,000 population. And those are Oshkosh, Neenah at number 1, Green Bay at number 3, and Appleton at number 4. There are others in the top 20, including Marinette, Manitowoc, Platteville, Sheboygan, and Fond du Lac, giving Wisconsin the dubious distinction of having 8 of the top 20 hotspots for COVID-19 in the country. And in terms of an unfavorable trajectory, Sheboygan has the second worst in the US. Oshkosh, Neenah is number 4, and Manitowoc and Wausau-Weston also are in the top 20. So looking forward over the next 2 weeks, there might be continuing problems in the Fox Valley, northeastern Wisconsin, and north central Wisconsin. If I could go to the next slide, please. This slide shows hospital indicators. Now, the number of cumulative hospitalizations in Wisconsin for COVID-19 since the beginning of the pandemic are at a little over 7,700. And our likelihood of hospitalization continues to go down, now cumulatively being 5.7%. So in other words, if someone is diagnosed with COVID-19 in Wisconsin, since the beginning of the pandemic, there's been a 5.7% likelihood of being hospitalized. And that has been improving since the beginning of the pandemic. And as we've said in previous webinars, there are probably many reasons for that. Better testing, earlier identification of contacts with isolation, better supportive care, some moderately effective therapeutics, and possibly the impact of masking that might actually cause people who have been exposed to COVID-19 and get infected to have a lower dose of inoculum and then a less severe infection. Now, Wisconsin hospitalizations yesterday reached an all-time high of 782 inpatients with a rapidly increasing trend. We have 209 patients with COVID-19 in intensive care units, and that's also a new high. And as you'll recall, hospitalizations and ICU use are lagging indicators. So we've had a very significant increase in new cases for over a month. But for the last 2 weeks, we've seen this significant trend of increases in hospitalizations and ICU use. Our ICU capacity also is decreased compared to a month ago at 263 immediately available ICU beds, but this has decreased. Our ventilator capacity is 1,919. It's stable and more than adequate, I think, for any anticipated surge that we might have for COVID-19. And our personal protective equipment supply chain has significantly improved, as have stocks of critical PPE in the state. However, those supply chains still remain fragile. Next slide, please. Now, this slide just talks about some key points about the current state of hospital utilization. Hospitalizations are rising in all 7 of the Healthcare Emergency Readiness Coalition regions, and COVID-19 hospitalizations are at or near all-time highs with exponential growth for the 6 HERC regions. And these are all of them essentially except for the southeastern Wisconsin, Milwaukee region. So Fox Valley has 130 hospitalizations, North Central 107, Northeast 127, Northwest 37, South Central, which includes Dane County, has 99, and West has 44. And it's also important to know that ICU admissions are rising in all 7 Healthcare Emergency Readiness Coalitions regions. And COVID-19 ICU admissions are at or near all-time highs for Wisconsin as a state and for 6 of our HERC regions, including Fox Valley, North Central, Northeast, Northwest, South Central, and West. ICU censuses also are high in 6 Healthcare Emergency Readiness Coalition regions, including Fox Valley at 87%, North Central at 70%, Northeast at 83%, Northwest at 89%, South Central at 84%, and Southeast, including Milwaukee, at 84%. Now, typically, you want to see ICU use at 70% or below. In areas with quaternary and tertiary care referral hospitals like South Central and the Southeast HERCs, you can generally tolerate ICU utilizations in the 80 to 85% range, just to give people a picture of what a normal situation would look like. I also need to make it clear that these ICUs are predominantly filled with people that do not have COVID-19. All other illnesses continue to go on. People are having surgeries, there's accidents, trauma, and sepsis that occur from other infections that would normally occupy intensive care units. But you can see that our margin of error for accommodating patients with any illness, including COVID-19, has shrunk from the optimal level. Now, in the southeastern HERC, which includes Milwaukee, COVID-19 hospitalizations and admissions are rising, but very slowly. We're not seeing an exponential increase like we are in the other 6 HERCs. But I would say that we need to be on watch for a boomerang from the other regions of the state. If you'll recall, 2 weeks ago, we talked about Dane County and the South Central HERC as being very similar to our region, Southeast and the Milwaukee HERC, in that there was a very slow rise in cases and ICU utilization, but not an exponential growth. That changed about a week ago. Just a couple of other points about hospitalizations. It's important for all of us to recognize that it's not easy or practical to move patients between hospitals, even at a place that's blessed with many hospitals like southeastern Wisconsin. And this is especially important if you're shifting people from one geographic region to another. And you also have to consider the risk of transport to personnel and inconvenience to family when you think about the statewide hospital and ICU capacity. It just isn't that easy to move people around from region to region. Now, it is easier to create surge capacity or internal capacity in healthcare systems when you have large tertiary and quaternary care settings like here in Dane County. So even if we have a surge, it's more likely that Dane County and Milwaukee County and the surrounding areas will be easily ready to take care of that surge. So if we go to the next slide, please. I just want to summarize the disposition of cases since the beginning of the pandemic. We have 80.7% of cases in Wisconsin that are categorized as recovered. In other words, they no longer have an active COVID-19 infection. I want to stress that that doesn't mean fully recuperated or returned to pre-COVID-19 infection health status. Many long haulers continue to have multiple symptoms of COVID-19 even months after recovery from the infection. We have 18.3% active cases. And as you might expect, that percentage has actually increased over the last few weeks as we've had this dramatic surge of new cases. And we have 1,381 patients who died for a 1% case fatality rate. Our cumulative deaths in Milwaukee are 434. And as we said in multiple previous webinars, and as you can see from the table in the middle, COVID-19 deaths in particular disproportionately affect people and communities of color, but they can be fatal for anyone. And as you can see, the majority of deaths in Wisconsin are among people who self-identify as white or Caucasian. And this is a particularly important consideration as COVID-19 is spread out into rural areas. The doubling time for positive tests shown on the right is 43.9 days in Wisconsin and 86.1 days in Milwaukee. These are trends that have stalled. They were really going favorably for many, many months before the beginning of September. The 7-day growth rate of positive tests is 1.9% in Wisconsin, 0.8% in Milwaukee, stable, but not as good as they were about a month ago. And the reproductive numbers actually are trending slightly favorably, down to 1.03 in Wisconsin and 1.0 in Milwaukee for the first time, not above 1.0 for the last month. If I go to the next slide, these next few slides address an issue that I've been asked to address by a member of the audience. It really has to deal with the controversy about how Wisconsin has reported the positivity rate. On September 23rd, the MacIver Institute published an essay that was critical of the formula that Wisconsin DHS uses to calculate the positivity rate. Now, if you look at this slide, you can imagine the positivity rate can be calculated either using the number of tests that are reported or the number of people who are tested. In thinking this matter through, it's important to understand that many people are tested more than once. And these happen particularly in settings like nursing homes, where there is weekly or biweekly testing of personnel and residents, frontline healthcare workers, students that have returned to school, and individuals that are in hotspots. And so in response to this criticism, DHS began to present positivity data 2 ways on September 29th, about 6 days after they received the criticism. And as shown on this screen grab from the DHS website, you can see that the dark brown line shows the positivity rate using the tests reported as well as the tests positive reported in any one day. And the light brown line shows the positivity rate. In other words, calculated by person. In other words, the number of people who tested positive compared to the number of people who were tested in a given day. If If I could go to the next slide, please. Now, I did want to say, as you can see on that slide, the positivity rate's higher when one uses persons rather than tests. So does this really matter? In my opinion, no. I believe this issue is really a tempest in a teapot. We need to recognize that public health data have a lot of subtleties and quirks. That's why we look at a panel of indicators and we focus as much or more on trends as we do on a single indicator at a single point in time. Now recall that the positivity rate is most useful for us to understand whether we're testing enough. And it also detects an undiagnosed burden of disease in the community. Also, we're more concerned with the trend rather than any single daily number. And using either formula, you can see that we've been trending unfavorably since the beginning of September. And finally, we do want the positivity rate, however you calculate it, to be well under 5% if we're testing enough people. And you can see that both calculations are over 5%. Next slide. So I don't want you to take my word for it. Let's see what a third party has to say about the McIver concerns. And I'm going to go to a PolitiFact report on September 29 that examined the McIver Institute report, and they basically titled their report, Analysis Bashing DHS COVID-19 Calculations is Built on Errors and Omissions. And in that report, they articulated that DHS has used a method in question since August of 2020, and that DHS has explicitly described their methodology on their dashboard. And it's important to note it hasn't changed during the surge. And DHS' original approach is the one that's used by many states. And DHS's original approach actually corrects for people that are tested multiple times, as I mentioned, in nursing homes, healthcare workers, students, and people in hotspots. And DHS's approach is the correct public health method. It prevents results from being skewed by people that are tested multiple times. And we're also focusing on the trend rather than the absolute number, which is a Wisconsin gating criteria. So their conclusion was that the report from the McIver Institute was essentially false. So if I could go to the next slide, I'm just leaving this slide here for your information. We're frequently asked what data sources we use to generate these bi-weekly webinars and our reports. And I just want to show you that we use multiple external data sources for these presentations. We prefer publicly available websites that are high quality, and you can see some of those listed there so that you can check for yourself. On occasion, we do use secure access data sites when we have specific questions that we need to answer. And we appreciate the availability and access of the WEDS data system and the Milwaukee County Unified Emergency Operations Center data, but those aren't publicly available. We also use internal analytics from the Medical College of Wisconsin, our Institute for Health and Equity, our Division of Epidemiology, and our Epidemiology Data Resource Center and Geographic Information System staff. So with that, I'll turn it back over to Tim.
Thanks, Dr. Raymond. And as is usual, after your presentation, we have a range of technical, personal, and business questions. So let me start out with one maybe that's a more technical question, and that is the seeming contradiction between the rising number of cases and the reduction in the R value, as you mentioned, in Milwaukee, close to 1. How do those two sync up?
Yeah, the R value is based on a trajectory calculation from the previous 7 days. And even if cases continue to rise, if you're replacing data from, let's say today, and removing data from last Tuesday, you can actually have a downward trend in the reproductive number. And it uses differential equations with a number of different compartments. So there's not a direct correlation between what you see in the daily rise versus that calculated number.
Okay, here's a kind of more personal question. As we come into the holidays, the question is really, what can families do to unite safely when they're currently living in separate cities or different communities? And you know, and the question goes kind of into the details then of, for example, if I'm visiting my nephew, what about touching toys or other types of things?
Right, well, these are all really hard questions, Tim. What I would start with is, even though you can spread COVID-19 by touch and by persistent aerosols, the primary route of spread is by respiratory droplets. So I'd say, to the extent possible, mask, maintain social distancing, and limit the circle of people that you interact with. Shrink your bubble. So I would also say know who you're interacting with and if they're being careful. So if your family members have shrunken their bubble, if they're adhering to the 3 W's, watch your distance, wash your hands, and wear a mask, you can probably relatively safely interact with them. The real problem comes with kids who may be going to school, and grandparents and uncles and that they're going to want to hug the children, and that's really a tough thing to do. And we're not asking people to go into complete lockdown, but I would also say get a flu shot and get it early rather than late. That can protect you from having an influenza-like illness that would confuse whether you have COVID-19, and can also protect you if you have the flu. Your immune system may not be as able to fight the COVID-19. But there's no real easy answer, Tim.
Yeah. And then Dr. Raymond, a kind of a broader question here. Do you have a sense of how much higher the mortality rate is this year compared to the same date for last year, inclusive of all reasons for death, not just COVID?
So a report, I think last Friday, suggesting that the US had 275,000 excess deaths in this time frame, and that about 210,000 of those were attributed to COVID. So there's an extra 65 or 70,000 deaths above what would be predicted. Those are being categorized as pandemic related, but those could be from suicides, depression, from people not getting illnesses treated, or from undiagnosed COVID-19.
Another question relates to what people can do to keep their workplaces safe. For example, focus less on cleaning of surfaces and floors and more on masks and distancing.
Yeah, Tim, let me just again say that the MMAC, and I would also say WMC, 2 of our most important trade associations here in the state, have done a really good job of providing guidance for our employers, and that the employers are trying very hard, I think, in every sector to protect their employees and their customers. But there's nothing fundamentally different in the employment situation than there would be in your home. And in fact, what I would say is I would encourage employers to remind people to practice the same safe policies they practice at work when they're out of work. And again, they're the 3 W's: wash hands, wear masks, and watch your distance. But for employers, especially as we move indoors, I think paying attention to the HVAC, increasing the number of air circulations and filtration of indoor air is going to be much more important. That's really important as more people congregate indoors, and as our awareness that even though persistent aerosols aren't the main source of spread of COVID-19, they are a source of spread that we can control in the environment.
Next question is really kind of looking at southeastern Wisconsin versus the rest of the state. And the number of COVID-19 hospitalizations has surged statewide since about September 20, but hospitals in southeastern Wisconsin have seen an increase in patients, but not to the all-time highs set in April. So the 238 on Monday was about the same as the peaks in June, July, and August, and lower than the one in May. What do you make of that?
First of all, I think because the pandemic came here first, we were more serious about intervening. And I think for the most part, remain more serious in some of the states that kept hearing about the 3 W's, but didn't see much COVID-19 in their community early in the pandemic. I'll just say, Tim, we look just like Dane County did a week or 2 ago. It's important to see our hospitalizations are rising. Even though the R number has come down to 1 for 1 day, there's likely to be a boomerang effect as the high burden of disease in northeastern Wisconsin, south central Wisconsin, communities that are contiguous to our region can come back to this region. So if we relax our diligence in any way, shape, or form, we could look just like Dane County looked 2 weeks ago and started to have a real surge a week ago.
So the next question is kind of asking your opinion of the report from the World Health Organization that estimated about 10% of the population worldwide had COVID. If that's true, that would dramatically reduce the mortality rate And so what's your thoughts about that?
I would say let's not overinterpret data from different countries. Let's just start there and recognize that the US and Europe have a better availability of testing than places like India and Brazil that have a very high, maybe Russia, high caseloads, and we really don't know how many people have been infected. So what we know is that in Wisconsin, we have about a 2% positivity rate using good serological tests, validated antibody tests that have low false negative and low false positive rates. I would just say our own experience at MCW is that we have about a 2.25% positive rate for antibody testing, which sort of tracks with the general population here. So I don't think, at least in our state, that that our mortality rate is artificially inflated. And most people are thinking that when this pandemic is over, the ultimate infection fatality rate, when we factor in undiagnosed cases, is going to be somewhere between 0.6 and 0.7%.
Okay. Is there a limit on how many people should gather for a business meeting?
There's no right answer to that. And what I would say is that MCW, we have a limit of 10 people with strict social distancing, and people wear their masks, even if they're in a very large conference room. We do make an exception for our learning environment, in which we'll allow up to 50 students in an auditorium. But we also are very careful about separating the students, adhering to face coverings, and having traffic flow in the auditorium that minimizes people crossing within each other's personal space. Our hospital partners, I believe, allow 20 in large rooms for meetings, but there is no right answer. But I would say, again, as more and more people move indoors, I would exercise extreme caution because, again, aerosols can spread the disease. So the longer we're in the same physical space, the more likely it is that someone that has COVID-19 will pass it on to somebody else.
So last question, Dr. Raymond, I know you have to jump off for a bit and then you're going to come back on. If neighboring states are calculating and tracking the same way we do, like Illinois and Indiana, how come they have such lower positivity rates, and how does this explain our extremely high numbers and their low numbers?
Well, first of all, Illinois has a larger population than we do. They're more than twice our size. So I think that has to factor into it. And you also have to think about where you are in the pandemic. If you're in a rapidly rising phase, you may exceed your steady state capacity to deliver tests. If you've already peaked and you're at a plateau where you're going down, you probably have plenty of testing capacity, and that is going to affect your positivity rate.
Thank you. Appreciate the time, Dr. Raymond, and I know you're going to jump off and jump back on, so we'll see you on the back end of this. Ken? Yep, I see you're getting yourself queued up there. Again, very much appreciate you joining us and bringing a wealth of experience in examining, trends and polling data. And it's going to be no surprise, I think, to this audience that this is some of the most divisive or split views as we look at the economy, COVID, and the election. So with that, I'd love to have take you through what you're seeing in your analysis.
Great, thanks. Thanks for the introduction, Tim, and good to be here, and good at least virtually to be back in Wisconsin this morning. And I've really enjoyed and been honored to get to do this work over the last couple years, working with Steve Boss on the polling here. Let me share some thoughts in the work that I've done for you, and also some general things that I'm seeing nationally through the various nerdy things that I'm doing. And let me share here, although I will share with you some concerns I have with all the data wizards and models, but this is a summary of the 538 slide of where the presidential race stands this morning on an average of polls. And you have Joe Biden with about a 9 percentage point lead. And what is striking about this graph is how stable it has been since March. Just imagine the number of things that have happened since March, and the number of times pundits have said this is going to move the race this or that, and yet we have had extreme stability over since March. And just, you know, in your head, start to think of all the things that have happened. I mean, good grief, just think of the things that have happened in the last week. So in the last 7 or 8 days, we have had the New York Times story on Donald Trump's taxes. We have had the debate. We have had President Trump diagnosed with COVID. We have others in the White House diagnosed with COVID. We have had President Trump go to Walter Reed Hospital, and then we have had President Trump leave Walter Reed Hospital. And then we've had whatever has happened this morning in the last 20 minutes when I haven't been able to check my phone. What's driving this? What's driving this stability? Well, I think it's a little bit something that I talk about with Steve a lot, and a point that that Tim made about the polarization that we first saw in Wisconsin many years ago when I was living in Madison, and that is now certainly the rule nationwide. And if any of my former students are on the line here, if you remember anything I taught you, it's the brilliant political science that Democrats vote for Democrats and Republicans vote for Republicans. And that has never been the truth more than it is now, where everyone is solid in their tribes. And in fact, in work that I've done for MMAC on people's appetite for doing various activities, Party ID explains not only your vote, but explains whether or not you're willing to get a haircut. What is different about the stability we're seeing this year, since obviously everyone remembers Hillary Clinton was in the lead in the national polls, it is significantly more stable. There are significantly fewer undecideds, and Joe Biden is not Hillary Clinton. That say a lot of things that decided the race in 2016, but I always title this chart "The Lovers and the Haters." People liked Hillary Clinton and disliked Donald Trump, no surprise who they voted for. If people liked Donald Trump and disliked Hillary Clinton, no surprise who they voted for. But both candidates were underwater, so you had a significant chunk of the electorate, nearly 1 in 5 voters, that disliked both candidates. And those voters, and especially in a place like Wisconsin, broke overwhelmingly for Donald Trump. This year, Donald Trump remains underwater, both in favorability and job approval on COVID. But the big story is that Joe Biden is, depending on the poll, between 5 and 10 percentage points favorable. So you have a fewer chunk of voters who dislike both, and it's actually the case this year that the voters who dislike both are more likely to go for Joe Biden. Now, of course, there's a bias in the national numbers for against the Democrats. So the Democrats can be up, as Hillary Clinton learned, 2 or 3 percentage points nationally, but still lose in the Electoral College. And that tipping point number has probably increased a bit, where Democrat Joe Biden could win the national vote by as much as 4 percentage points and still lose in the Electoral College. And of course, the game is to get to 270. And Donald Trump got to that 270 by winning traditional Republican states, along with swing states like Ohio and Florida. He only needed to win 1 out of Wisconsin, Pennsylvania, and Michigan, but won all 3. And again, this year, Wisconsin, Pennsylvania, and Michigan are certainly key battleground states. But the game is, and going backwards here, for Joe Biden needs to pick up 38 more Electoral College votes to get to 270 from Hillary Clinton's 232, assuming he holds on to everything that Hillary Clinton had, which seems a reasonable assumption now. Donald Trump just needs to win one of those states of Wisconsin, Pennsylvania, and Michigan if he holds on to everything else he won before. And Florida is definitely competitive, Arizona is definitely competitive, and North Carolina and Ohio are also competitive now. When you look at the upper Midwest, and I'm going to say a little bit more about this, the story in the upper Midwest, which won it for Trump in 2016 and continues to make it competitive for him now, and perhaps even makes a state like Minnesota competitive, is the number of non-college whites in the upper Midwest and the number of non-college whites who may be non-voters, who didn't vote previously, who could be mobilized to vote this time. The story in those Sunbelt states is suburban whites, much more likely to trend Democratic, and an increase in non-white turnout and an increase in non-white population, chiefly Hispanic and Latino population. Looking at the latest numbers in Wisconsin, and I can't see you all, but I bet not a trivial number of you have been polled, since everybody in the country seems to be polling in Wisconsin. This is the average Biden margin for publicly released polls in September. In the work that I've done with MMC, and you see these ranging from about 6 to 10. In the work I've done for MMAC, we are more on the high side there of the Biden lead in the 9 to 10 range. And one point I want to make here, which is something we Steve and I played around with in the last poll, which he always lets me do some nerdy stuff, and I think we had some success in the analysis here. One thing you hear is Democratic concerns about turnout because people are not very enthusiastic about voting or very enthusiastic about voting for Joe Biden. So we asked respondents in Wisconsin, we asked Wisconsinites how enthusiastic they were about supporting their candidate. About half, or exactly half of Wisconsinites said they were very enthusiastic. And Donald Trump actually won those very enthusiastic voters by 2 percentage points. So the analysis, or the spin, if you will, from people who are trying to figure out a way that Donald Trump might be doing better is that Trump voters are more enthusiastic and that Trump voters will be more likely to vote. But we also asked a question about how certain you are to vote. Most pollsters ask one or the other, either how enthusiastic you are or how certain. And we have, and Wisconsin's a high turnout state, about 8 in 10 Wisconsinites saying they're absolutely certain. And when you look at the absolutely certain voters, Joe Biden is winning them by 14 percentage points, absolutely certain that they're going to vote for Joe Biden. So we combined the two. And what you see, about half the electorate is enthusiastic about who they're voting for and certain they're going to vote. And then you have another large chunk, 30%, who are certain who they're going to vote for, but they are not particularly enthusiastic in their choice. And this election, and Joe Biden is ahead nationally, and Joe Biden is ahead in Wisconsin, because even though a significant chunk of his voters are unenthusiastic about him, unenthusiastic about his candidacy, they are absolutely certain they are going to vote for him. Put another way, they might not be enthusiastic about voting for Joe Biden, but they are very enthusiastic about voting for Donald Trump. So this certain and enthusiastic, they're splitting the votes, and that's about 50% of the electorate. And then this other chunk of the electorate, about 30% of the electorate, who are certain in their vote choice, but not particularly enthusiastic, are breaking overwhelmingly for Joe Biden. That's something that I'm going to add in to some of the national polling I'm doing, and something that I think we will continue to do in our Wisconsin polling. Let me talk a little bit about some of the models that are out there. So the 538 model has Biden with an 81% chance of winning. The Economist model has Biden with an 86% chance of winning. I'm pretty nerdy, but for some reason, the 538 and the Economist nerds went to war about the 5 percentage point difference in their models. I think it is useful to pay attention to the election forecast models. It provides a probabilistic assessment of the state of the race more than a dichotomous or zero weight, one weight assessment of the race. It doesn't only allow you to bring in one poll or a series of polls, it allows you to bring in national polls and state polls, and also to understand that what's happening in Wisconsin, that the polls in Wisconsin, if things are moving in a particular way in Wisconsin, it's probably not divorced what's happening in a Minnesota, Ohio, a Michigan, or a Pennsylvania, and allows you to continually update. What, and perhaps this is just my therapy for 30 seconds, what annoys me about the models is they have set themselves up so they are never wrong. For most of you who are involved in various things in civic and business life, you may be making probabilistic assessments, but there's also dichotomous consequences often. So in the work I do for ABC on election night, we can be wrong, right? If we call the race wrong, we get it wrong. And the way the forecasters cheat a little bit is, so in a 2012, when they go through all the states, and any state that they say Obama is going to have more than a 50% chance of winning, if he wins, they count that as being correct. In 2016, when 538, for instance, gave Hillary Clinton a 71% chance of winning, and some had even a higher, they then say, oh, we told you there was still a 30% chance that Hillary Clinton could win. So that might be a bit nerdy or just my therapy. I do think it is important to look at multiple polls, multiple pieces of information, multiple economic indicators in making assessments about the race. But in terms of sort of after fact assessments, be very careful when one sets up their analysis in a way that they can never be wrong. A little bit of data here on a point I made before about where the non-voters are. So many of those Sunbelt states, which have been traditionally Republican, have potential to be more Democratic because there's lots of non-college, there's lots of non-white voters, non-white non-voters, non-white people who didn't vote in 2016 who could vote in 2020. So there's potential Democratic votes there. In upper Midwest, Rust Belt states, Michigan, Minnesota, New Hampshire, Pennsylvania, and Wisconsin, there's a significant number of non-college whites. What's also interesting, and back when I was at UW, I did a number of studies, and I think some of the first work I did with MMAC was on workplace issues and training issues. Even though the national polls always lump non-college whites, actually will sometimes lump whites together, don't distinguish between college-educated whites and non-college educated whites, there's also significant variance in the number and type of non-college educated whites, whether it's just a high school education, whether they have some sort of associate's degree, and you see Wisconsin is high in that, or whether they started college and were never able to finish. And very quickly here, there is variance in the attitudes of people depending on, among white voters, depending on the nuance of their education or the level of their education, where you see that whites with high school or less are the most overwhelmingly Republican in the electorate, whereas that goes down monotonically, as does Trump's approval, as you increase in education. Vote by mail, which is obviously going to be a thing in Wisconsin. We're seeing it in our state polls. We are seeing it in the national polls that Republicans are much less likely to vote by mail. Biden voters, Democrats, much more likely to vote by mail. What's interesting is we are also seeing this in assessments of the voter file, but in less stark than the survey research. There may be some social desirability bias of Republicans wanting to say they're voting in person because they think that's the correct answer for their tribe, and Democrats saying that they're not going to vote in person, that they're going to vote by mail because they think that's the correct answer for their tribe. But when you actually track the voters that are coming in by mail, there's a modest Democratic advantage, not as massive a Democratic advantage as we're seeing here. A couple thoughts on state of Wisconsin, both polls that others have done, including the fantastic Marquette University poll done by my good friend and former colleague, Charles Franklin. We have seen since the pandemic started. Governor Evers' approval reached a high of 65 to 29 in the early days of the pandemic. That has gone down significantly from that plus 36 to plus 8 in Charles's last poll. And we are seeing that exact pattern in the work that I am doing for MMAC. On the last MMAC poll, given everything that's happening in this country, obviously given everything that's happened in Wisconsin and in Kenosha, we asked questions on racial justice, on police, and we see an overwhelming majority of Wisconsinites say that police in Wisconsin need to continue making changes to treat Black people equally to white people. We also asked questions consistent with national data about whether people thought that recent shootings were isolated incidents or are part of a broader problem. And Wisconsinites did think it was part of a broader problem. That said, even though Wisconsinites think the shootings are part of a broader problem, even though they think there is much more work that the police needs to be done, they still generally have strong favorable views towards the police and absolutely do not support defunding the police. And we ask that both flat out, do you support or oppose defunding the police? And then what I call an informed ballot, when you say where the money would go. So flat out, it's only 14 support. And then when you tell people that the money is going to go to mental health, housing, and education, but would mean fewer police officers, you still have overwhelming opposition to that particular public policy. In terms of whether Wisconsinites privilege controlling the spread of the virus over restarting the economy, this is a number that has been consistent. This is the third survey, and this is now a couple weeks old, that I've done for MMAC since the pandemic, and we have consistently seen that Wisconsinites privilege controlling the spread of the coronavirus, even if it hurts the economy. In terms of getting the vaccine, we see only a little over 1 in 3 definitely say they are likely to get the vaccine. I often like to look only at those the more intense answers, but when you add the definitely get and probably get, you get a higher number of 63%, but you still see, consistent with national numbers, some reluctance among Wisconsinites, some reluctance among people nationwide. And that is actually among both Democrats and Republicans about getting a vaccine when it was available. Lastly, and again, consistent with national numbers, perhaps even a little bit higher in Wisconsin, people are concerned, and this is asked of people who have kids at home, people who have kids at school, are concerned about their children falling behind in school. So if Steve's looking at me, you'll see I have a big smile on my face. I had like 400 slides, but Steve made me cut that down to 23 or 24 here, and wanted to get through some information for you. But if we have time, Tim, happy to answer any questions.
Yeah, Ken, thank you very much. And there are some questions here. I'm going to start with one here that says, when you divide out white education levels and which party they are more likely to vote for, should you not divide out non-white education levels? Let me just see if I can get this. Oops. Should you not divide out non-white education levels when you state which party they are more likely to vote for? And better yet, just divide the education level and leave race out, since we're all Americans.
So yes, we are absolutely all Americans, but I'm also a survey researcher who is looking for meaningful crosstabs. So in the same way that even though we are all Americans, I break us out by gender and which region we live in. It is meaningful to be statistically accurate in engaging public attitudes, to have the correct number of different demographics. And a main demographic, and one of the main reasons why the polls were wrong in 2016, is not necessarily that there were too many too many white respondents or too few non-white respondents, but it was that there was too few white respondents without a college education. And the reason why in this particular analysis, why I did not break out education levels among non-white voters is there are differences in the attitudes of non-white voters and in a state like Wisconsin among Black voters, but they tend not to be by education, they tend to be more by age. So put another way, among white voters, someone with a high school education is going to have a vastly different attitude than someone with a college education or a master's education or a PhD. Whereas among Black people in the Black community, there's going to be less variance in political attitudes by education. We are seeing younger Black people are still overwhelmingly going to vote for Joe Biden, but at levels that are less than their parents and grandparents.
So Ken, question kind of looking back to the last election and polling then and polling now, are there any concerns regarding folks who refuse to be polled? And also, are you positive they're polling equal amounts of Democrats and Republicans?
I'm not positive of anything. So I do think things are better than 2016. There was, in many state polls, there was absolute malpractice in not waiting on education and not waiting on race. That has been generally fixed. The race is more stable. There are fewer undecided. So all of those things give me optimism that the polls will be more accurate. That said, you're not talking to who you're not talking to. And so people talk a lot about shy Trump voters. And I always find it amusing to use the word shy and Trump in the same sentence. So I think it's not so much the case that people who are talking to you are lying, are saying they're going to vote for Biden when they're really going to vote for Trump. I do think there are issues in reaching younger, non-college educated white voters. So there's non-response issues. I also think you see, right, the Packers won last night. So everybody read 5 newspapers and watched ESPN this morning. And it's actually a noticeable thing back when people used to buy newspapers, right? If the Packers would lose, the circulation of the Milwaukee Journal-Sentinel the next day would be much less. So it's also the same with polling. When your side is doing well, you're much happier to talk to a pollster. When your side is having a tough week and Republicans had a tough week, you're less likely to talk to pollsters.
So Ken, maybe you're answering these questions too, but a couple along the same lines. None of my conservative friends respond to polls. Do you adjust data for these types of behaviors?
So I do not adjust, but listen, Wisconsin is a state that is equally divided between Democrats, Republicans, and independents. And listen, my bias here is I think Charles Franklin is brilliant and a terrific pollster. And you have a long time series of data from him. So we know what the partisanship of Wisconsin looks like. So if I see a poll that's massively Democratic in Wisconsin in terms of party ID or massively Republican in Wisconsin in terms of party ID, I would question that. In all the work I've done with you, when we do some weighting on education, because it's always the case you get fewer young people, it's always the case that you don't get as many non-college educated white people. The problem is if, and again, I can't see people, but if it's folks in Waukesha County who have a college education who aren't talking to the polls, that could create some bias, and that's probably part of it. But it's not going to explain 5 or 6 points. It could explain a couple percentage points.
So Ken, and I know you didn't have a slide up on this, but in one of the recent polls, actually multiple polls you've done for us, there is a big difference between people that identify as Democrats and people that identify as Republicans that are in their normal course of business willing to go out to eat, go to church, go to a bar. And you mentioned something in the beginning that party ID explains everything. What do you think is behind the and sometimes it's 2 to 1 or 3 to 1 in terms of a willingness to do something versus not willing to do it. And that may explain kind of a lot of the challenges we have in containing COVID across the state. But in looking at that, how do you assess that in Wisconsin?
It's the power of partisanship is phenomenal. That people figure out what the correct answer is for their party, for their tribe. And it's very clear when you look at what the president says, what Republican elected leaders are saying in Wisconsin versus what Democratic elected leaders, including the governor in Wisconsin, are saying, and both attaching yourself to your team and repelling yourself from the other team, people quickly learned what the correct answer was for their team.
So if we asked you as a pollster to help us navigate a message that's going to get people to, as Dr. Raymond would say, kind of follow the guidelines that work, how would you navigate the differing views on both sides?
Seconds from a clean getaway. Listen, it will take the single most important factor that could drive Republican attitudes is something that Donald Trump would say. It's a very simple answer. There's probably a marginal effect at what Republican elected leaders could say in Wisconsin, but the president of the party in power is always the biggest driver of their partisans. This president in particular, on a wide variety of issues, is a driver of those attitudes.
All right, and then last question before we go, kind of in the polling you've done, give us a sense of Wisconsinites and their view of the economy and looking forward. And you gave us a little bit of a glimpse of that when kind of COVID and safety from COVID kind of trumps the economy.
It's it's very interesting and nuanced in Wisconsin. There's great pessimism in the direction of the state. And that's perhaps because the Republicans think the Democrats are in charge and the Democrats think the Republicans in charge. So usually when you have a Democratic governor, Democrats would think the state's going in the right direction, would be giving positive assessments of the economy. You're not getting that in Wisconsin. President Trump is actually doing better nationally in assessments of the economy, and often better than Joe Biden in assessments of the economy. But what we saw in the polling in Wisconsin was at some point the election becomes about something. And perhaps obviously when this election became about COVID, that became very problematic for the president and very problematic for Republicans in Wisconsin.
Professor Goldstein, thank you very much for the insightful analysis and answering the tough questions. Very much appreciate it. And Dr. Raymond, thank you again for the insightful update on where we stand with COVID. So I want to thank you both, and we'll be back again on October 20th, a week, 2 weeks from now, with another update of business strategies during the pandemic. So again, thank you both and have a good rest of your day.